Hello everyone and welcome to the Mind Body Mountain podcast. Today we are talking about the ACE study and asking the question, what if many of our most serious public health problems, chronic disease, complex trauma, cardiovascular disease, smoking, obesity, depression, and more, are attributable to experiences in childhood? Stay with me to learn more and also to find out what the 10 questions of the study actually are so that you can gain some insights for your own journey. Let us start by answering the question, what is the ACE study? Well, the study was conducted by the Centers for Disease Control and Kaiser Permanente in the mid-1990s. Kaiser Permanente provides healthcare services to members, and the CDC works to fight disease and supports communities and citizens in the USA to do the same. The initial study with a group of patients insured through Kaiser Permanente focused on how traumatic childhood events may negatively affect adult health. The 17,000 participants surveyed were asked about their experiences with childhood maltreatment, family dysfunction, and current health status and behaviors. The ACE study originated from Dr. Filiti's groundbreaking work in the mid-1980s, where he developed positive choice programs to support individuals in overcoming obesity and achieving sustainable weight loss. Dr. Filiti was surprised to find that the people most likely to drop out of the program were the ones who were successfully losing weight. Upon further investigation, Filiti realized that many of his patients had been abused as children and were using obesity as a shield against unwanted sexual attention or physical attacks. Furthermore, Filiti learned that a number of his obese patients had, at some point, used tobacco, alcohol, or street drugs in attempts to cope with past adversity. Around the same time that Dr. Filiti was making these initial connections between child abuse and negative health outcomes, Dr. Robert Ander was studying similar medical and public health problems at the Centers for Disease Control and Prevention. So, they teamed up to investigate the role of child abuse and neglect in medical, social, and public health problems. The doctors designed the ACE study to determine whether adverse experiences prior to one's 18th birthday could be related to negative health outcomes in adulthood. Ander and Filiti surveyed nearly 17,000 adults who had healthcare coverage through Kaiser Permanente. The researchers asked 17 questions across 7 categories of negative childhood experiences encompassing abuse, psychological, physical, and sexual, and household dysfunction, substance abuse, mental illness, the mother being treated violently and criminal behavior in the household. The results of the original ACE study were surprising. More than half of the participants reported experiencing at least one of the adverse events across the 7 domains of abuse and household dysfunction. The most commonly endorsed events were substance abuse in the household, 26%, followed by sexual abuse, 22%, and mental illness in the household, 19%. Filiti and colleagues also found that ACEs were highly related, meaning that for participants reporting any ACEs, the probability of exposure to additional ACEs ranged from 65 to 93%. Importantly, the groundbreaking study found that, as exposure to ACEs increased, the likelihood for unfavorable outcomes such as disease risk factors, lack of healthcare, and mortality increased. Alarmingly, compared to participants without exposure to ACEs, those respondents with 4 or more categories of ACE exposure had an odds ratio of 12.2 for the history of suicide attempts. These individuals with more categories of ACE exposure were much more likely to experience a suicide attempt. Furthermore, the prevalence and risk of alcoholism, use of illicit drugs, injection of illicit drugs, report of 50 or more sexual intercourse partners, and history of sexually transmitted disease were found to increase as the number of ACEs increased. Similarly, participants with 4 or more categories of ACEs were compared to those with none, and there was a clear relationship between childhood ACEs and disease conditions. Individuals with 4 or more ACEs were more likely to have chronic bronchitis, emphysema, stroke, heart disease, hepatitis, jaundice, and skeletal fracture. This research shows that ACEs are common, ACEs are interrelated, and there is a clear dose-response relationship between ACEs and negative health outcomes in adulthood. The participants in the sample were predominantly white, educated adults with good healthcare coverage. The nature of the sample in the Felitti et al. 1998 study is important, as it may be easily, but incorrectly, assumed that ACEs are limited to those with low socioeconomic status or individuals who have had a rough life. So, what is the connection between ACEs and trauma? Well, trauma, particularly in childhood, has profound effects on physical and mental health due to its impact on the body's stress response system, the HPA axis, hypothalamic pituitary, adrenal axis. Chronic exposure to stress activates this system, triggering the release of stress hormones like cortisol and adrenaline, which are essential for managing acute stress. However, when stress is prolonged and unresolved, hyperarousal or hypoarousal occurs. Hyperarousal leads to consistently high cortisol levels, increasing risks for cardiovascular diseases, immune dysfunction, and digestive issues. This state of overactivation can also exacerbate anxiety and emotional dysregulation, where hypoarousal results in insufficient cortisol release, leaving individuals vulnerable to depression-like symptoms and an inability to respond effectively to stress. The cumulative impact, especially when trauma occurs during key developmental periods, results in a greater risk of chronic conditions, including heart disease, diabetes, and autoimmune disorders. There are also brain changes which impact stress regulation for people who have experienced trauma. Trauma reshapes key areas of the brain involved in emotion, decision-making, and stress regulation. For example, the amygdala can become hyperactive, heightening sensitivity to threats and contributing to anxiety and fear responses. The prefrontal cortex can suffer from reduced efficacy in regulating emotions, making it harder for individuals to manage impulsive reactions, make rational decisions, and exercise self-control. This diminished function also weakens problem-solving abilities and heightens vulnerability to stress-related disorders. Trauma can also reduce the size of the hippocampus, impairing its role in memory formation, learning and assessing the context of threats. This can lead to difficulties distinguishing between safe and dangerous situations, contributing to hypervigilance or avoidance behaviors. Together, these changes can disrupt the balance of the brain's stress regulation mechanisms, perpetuating cycles of fear, anxiety, and dysregulation. This underscores why trauma survivors often experience heightened emotional reactivity, memory challenges, and difficulty coping with everyday stressors. The good news is that the effects of trauma are reversible, because we now understand how trauma influences mental and physical health. This allows us to implement targeted interventions. From internal family systems, IFS therapy and EMDR therapy, to somatic experiencing, meditation, breathwork, and beyond, modern approaches to trauma healing emphasize the profound connection between mind and body. These methods are designed not only to reduce the dysregulation of the nervous system, but also to cultivate greater self-awareness. By addressing deep-seated thought patterns, self-limiting beliefs, and inherited legacy burdens, individuals can reconnect with their innate capacity for healing and growth. These integrative practices offer tools to process trauma, regulate emotions, and foster resilience, paving the way for lasting transformation and well-being. Next, I will go through the questions included in the ACE study. Remember, the quiz was designed to serve only as an indicator of how likely a person might be to face challenges in later life. It is important to recognize that it is not inevitable that just because a person has experienced a high level of ACEs, they will go on to experience social, emotional, or health problems. This is because some children develop resilience, the ability to overcome serious hardship, while others do not. The most common factor among children who show resilience is at least one stable and responsive relationship with a supportive adult to mitigate their stress. There are also certain things the quiz does not take into consideration. For instance, many experiences could be traumatic for children that are not included in the quiz. Community violence, racism, other forms of discrimination, natural disasters, and housing insecurity. This means that answering all the questions in the ACE quiz will not give a full picture of the adversity a child has faced and, as such, cannot be used as a true indicator of potential risk. Neither will it deliver a full picture of the possible solutions communities could consider. I'll now read the questions, and for each yes answer, add 1. The total number at the end is your cumulative number of ACEs. Remember to add yes if the experience was before your 18th birthday. Question 1. Did a parent or other adult in the household often or very often swear at you, insult you, put you down, humiliate you, or act in a way that made you afraid that you might be physically hurt? Question 2. Did a parent or other adult in the household often or very often push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? Question 3. Did an adult or person at least 5 years older than you ever touch or fondle you, or have you touched their body in a sexual way? Or attempt or actually have oral, anal, or vaginal intercourse with you? Question 4. Did you frequently or fairly often feel that no one in your family loved you or thought you were important or special? Or your family didn't look out for each other, feel close to each other, or support each other? Question 5. Did you frequently or fairly often feel that you didn't have enough to eat, had to wear dirty clothes, and had no one to protect you? Or your parents were too drunk or high to take care of you or take you to the doctor if you needed it? Question 6. Did a parent pass away, or were your parents ever separated or divorced? Question 7. Were one of your parental figures often or very often pushed, grabbed, slapped, or had something thrown at them? Or sometimes, often or very often kicked, bitten, hit with a fist, or hit with something hard? Or ever repeatedly hit over at least a few minutes or threatened with a gun or knife? Question 8. Did you live with anyone who was a problem drinker or alcoholic or who used street drugs? Question 9. Was a household member depressed, suffering from acute mental health issues, or did a household member attempt suicide? Question 10. Did a household member go to prison? In terms of how to interpret the results, the following information is given by the ACEs Aware organisation. So if the AC score is 0, the patient is at low risk for toxic stress. The provider should offer education on the impact of ACEs and other adversities on health and development, as well as on buffering factors and interventions. If the AC score is 1 to 3 without ACE-associated health conditions, the patient is at intermediate risk for toxic stress. If the AC score is 1 to 3 and the patient has at least one AC-associated condition, or if the AC score is 4 or higher, the patient is at high risk for toxic stress. In both cases, the provider should offer education on how ACEs may lead to toxic stress and associated health conditions, as well as practices and interventions demonstrated to buffer the toxic stress response, such as sleep, exercise, nutrition, mindfulness, mental health, and healthy relationships. The provider should also assess for protective factors, jointly formulate a treatment plan, and link to supportive services and interventions as appropriate. The ACE study offers valuable insights for individuals seeking to understand the connection between their health challenges and past experiences. Its findings not only shed light on the lasting effects of adverse childhood experiences, ACEs, but also empower communities with the knowledge needed to address these root causes. By fostering nurturing environments and implementing preventive measures, we can significantly reduce the prevalence of trauma and its far-reaching impact, creating healthier, more resilient communities. Thank you for tuning in to the Mind Body Mountain podcast today. Be sure to check out my guided meditations, which are useful for calming down your nervous system, and also the IFS guided meditations, which will help you to uncover and work with your inner parts that may need some support to allow you to heal. If this episode has helped you, please give the like button a boop and subscribe. It helps the channel so much in reaching those who need it. Until next time, be kind to yourself